Good evening and welcome to Doctors in the House. My name is Dr. Darryl Hill, and as always, it is a pleasure to be here with you today. Today is especially a great day because I'm glad to see a good friend of mine in the house, Dr. Charles Weng. Dr. Charles Weng is going to go ahead and just introduce himself.
Hi, my name is Dr. Charles Weng. I am an internal medicine physician for over 21 and a half years. And currently practicing in the Towson, Maryland area. In the last 3 to 4 years, I've grown a particular interest in cannabis medicine, and it's been a wonderful, wonderful last three to 4 years.
Well, I got to tell you, Dr. Weng, Charles, I'm really excited to have you here in the house today because we have an exciting topic. There's a lot going on in the state of Maryland and in the country when it comes to medical marijuana, cannabis. What do you think about what's going on right now with this topic?
Well, I'm very, very excited. It is just a wonderful time, an exciting time in Maryland and the country in general. What we've seen over the last several years is an evolution of not only patients, but providers, physicians, therapists, psychologists, etc., embracing this alternative treatment for not just medicinal treatments, but for overall wellness and health. So it's just a wonderful thing to see.
Right, and let me remind the viewers, this is a call-in show, and the call-in number is 240-719-2560. So let's just get right into it, Dr. Weng. Let's go ahead and break it down. What exactly is medical marijuana, cannabis. Let's break it down. CBD, THC. Why don't you go ahead and just try to break it down a little bit?
Sure, there are a lot of confusing terms out there. Medical marijuana is, I think, a term that evolved over the last 25 years or so, ever since the first dispensaries in Colorado and California came out. Essentially, it's just marijuana that is bought from a dispensary that the state has endorsed. It is typically a place where one can get a variety of marijuana in different forms: oils, tinctures, topicals, salves, etc. And in order to dispense it from a dispensary, it comes from a lab called a processing center, where measurements are taken to determine the amount of THC or CBD or terpenes and other ingredients to make sure that it's safe from insecticides and pesticides, etc. And also where it's actually grown, called a cultivator, they are also inspected by the state to make sure that the crops are good and that it's safe to move forward to the processing center, as I spoke about, and the dispensaries for patients to purchase.
Yeah, so we're definitely going to look at the big picture here, because the past year especially, there's been so much excitement with the growth and the economics, and you and myself and many others are seeing the economic benefits along with the incredible clinical benefits too. So why don't we do this? Let's go ahead and get our video going. We'll take a quick look at this video and then get back into the program. Me personally, I'm using it a lot for pain and anxiety. What kind of indications and experiences are you having?
So I would say that pain and anxiety, chronic pain in particular, are the two most common conditions that people come to my office for, seeking assistance and help. Interestingly enough, out of the conditions that are listed in our state as to what's appropriate for medical marijuana usage, anxiety is not there. I think that will change soon. But as you talked about, there are many different forms of chronic pain for different reasons: rheumatoid arthritis, chronic back pain, different forms of inflammatory conditions, neuropathic pain, etc. And what I found in the last 3.5 years or so was that the cannabinoids in general, CBD and THC, CBD being the non-psychoactive form, the second most common cannabinoid in the plant, has been very helpful and effective in reducing inflammation, pain, and anxiety. And it's also been very effective in allowing patients to decrease or even come off of many of their pain medications, including opioids and anti-inflammatory medications. So it's been particularly helpful for me to continue treating patients in a more effective way, particularly seniors. In fact, I'm seeing a lot of seniors come in because of their chronic conditions, because of insomnia, anxiety, depression, chronic pain, as we spoke about. And it's really challenging simply to use typical medications for these patients because of side effects, because of issues that they have being on many other medications for other medical conditions. So it really helps us, helps me, I should say, to treat patients in a more customized way using CBD and THC in various preparations to bring about a much better quality of life. Patients are sleeping better, patients are less anxious, having less panic attacks, they're able to move and be more active and interact with their family members and friends again, getting off of many of the opioids that I talked about, and just in general feeling a lot better.
Exactly. You know, the funny thing is, I can sit here and really listen to you talk and us talk on this specific point probably for another hour or so because I think you're right. When we look at the quality of life patients are getting back, especially in the setting of the opioid issue, where a lot of those opioids were taken away from people and how much suffering they really had. And I don't know what your experience has been. What has that conversation been like when you had to talk to that 80-year-old about marijuana? What was that like? Because I know what it was like for me, and it wasn't always easy.
So, interestingly, I'm getting many referrals from other primary care physicians, from GI physicians, oncology colleagues, cardiologists even, some neurologists, because this very issue. And so a lot of the patients, a lot of the senior patients are actually coming from other physicians, for example, rheumatologists. And so they're actually more receptive than we think. That is to say, the seniors are more receptive than we think to this plant-based medicine. They have been through many other conditions, medications, side effects. Of course, they're the most vulnerable to the side effects. You give them a medication and they have an upper GI bleed, or you give them a muscle relaxant and they get up in the middle of the night and they fall and they hurt themselves.
Break a hip.
Break a hip. They've had surgeries and they don't recover as well. Their immune system is compromised, so they're often more susceptible to postoperative infections and blood clots. So these patients are very interested in being able to find an alternative approach and treatment to their very difficult to treat conditions. And so for me, I've seen a lot of, I would say that, Dr. Hill, about 45 to 50% of my patients, especially my new patients, are over the age of 55.
Yeah, and it's funny too. One story always comes to mind when we talk about that older patient. It was kind of early in that time period when medical marijuana was available, and I brought up the topic of medical marijuana to an 80-year-old, and she looked at me like I had three heads. Sure. And we pretty much tabled the discussion. However, about 8 months later, she came back knocking on the door looking for it, only because she had spoken to a friend who was using it and who was happy and doing well, and now she felt more comfortable. I don't know about you, but I find out there are two things you got to mention to people. You got to tell them you're not going to have to smoke it, and you got to tell them you're not going to walk around high as well. What do you think about that?
I think you're absolutely right. I think that as physicians, as providers, it behooves us to learn as much as we can about this evolving field so that we are able to help our patients learn how to administer their medications, the different ways to take the medication, how to take it, when to take it, how it interferes or interacts with their other medications. So a lot of times the patients are looking for us to guide them. And I think that is important, because if you think about the alternative, sometimes when you send a patient to a dispensary, you just don't know who they're going to encounter, what that young person, or not necessarily a young person, but the other person's experiences are. And remember that they are simply perhaps adept at the different strains that they're offering at that dispensary, but not necessarily how to treat an elderly patient with a particular problem. So for the physicians to learn and acquire the knowledge to help their patients, particularly our seniors, I think is really important. And absolutely, to that end, there are many different ways to administer the cannabis, whether it's in a tea form or a tincture, a salve or a topical lotion, a capsule, a gummy, a pill. There are many different ways to take it, and it can be taken in ways where there's no intoxicating effects, or at least minimal. And once we're able to have the patient feel confident about doing that and doing it slowly in a way that there's little to no harm, then the patient seems very receptive. And of course, when they have a friend or a neighbor who they relate to, whether it's via age or condition, and they've tried it, that's going to encourage that patient to come forward and give it a shot.
So let's be clear. Medical marijuana has over 100 particles in it, and the two most active particles will be the CBD and the THC. Do you want to maybe just mention what we normally get from those two particles?
Sure. So the THC, or delta-9 tetrahydrocannabinol, is about 55% of the percentage of compounds of cannabinoids in the cannabis plant. CBD, which stands for cannabidiol, is the second most abundant. The primary difference is that the THC is psychoactive and the CBD is not. The similarities are that they're very similar in their molecular structure. They, however, work in different areas in the body. THC works on different receptors that you find in your central nervous system, your peripheral nervous system, your immune system, and some other organs. The CBD is found in other areas that not specifically bind to receptors in the brain or central nervous system. Because you don't have that specific binding in the brain, you do not have the psychoactive effects. This allows this compound or product to be used in a very practical way, meaning that for patients who have to drive, go to work, take care of children, etc., we can use CBD for conditions like inflammation and pain and anxiety. I have a lot of patients, for example, who the first time they get up in the morning, they're very anxious. They may have nausea. They may have to go to the bathroom several times before they even get out of the house. With just a few drops of CBD oil under the tongue or in their tea or coffee, that can help them relax without sedating them or impairing them, and they're able to drive and work and function well. So I think that CBD has an additive and synergistic effect with the THC. THC, therefore, can be used in addition, but at lower doses, because once again, they work in a synergistic way. And at the same time, CBD can diminish the high effect from THC. So what I find myself doing for a lot of the patients is trying to help them come up with this a regimen where they actually can take very, very small doses of the THC along with CBD. And this form of treatment is what we call microdosing. And when we do it this way, we find that we get similar efficacy in terms of pain management, insomnia, treating insomnia and anxiety, without the side effects that you might get from high doses of the THC.
Which patient might that be?
First of all, I think that in general, all patients, you see, what we don't have are actual dosing charts or regimens. We don't have large studies to say, what's the dosage of CBD or THC for insomnia? What's the dosage of CBD or THC for migraine headaches or for back pain, etc.? I think what we'll find as these studies ensue, large studies that is, that it's going to vary a lot. And probably the safest and effective way to find out what a patient's specific range is to start low and gradually increment, perhaps by about 2 to 3 milligrams of THC at a time, while keeping some CBD available on board. So whether it's a young child who's suffering from seizures or autism, or it's a 78 or 88-year-old patient suffering from PTSD or rheumatoid arthritis, the idea always is to go slow and to gradually work your way up until you find a perfect balance between a therapeutic benefit and side effects. And this is one of the reasons why I believe that using this kind of approach, using cannabis that is, and CBD is very effective, is because it allows the patient to customize their regimen in a given day, not just in a 3-month span or 1 week span. You know, some days we wake up and we feel more down, or we feel more energetic, or we have a little bit more aches and pains, right?
Monday versus Friday for me. Mondays I'm down, Fridays I'm up.
Mine starts Sunday. Mine starts Sunday evening. So, but I know exactly what you mean. And so, imagine suffering from a condition like anxiety or depression, and how you have even more varying degrees of symptoms. Well, a patient, perhaps on a day where it's rainy and damp and cold, may require 5 drops of a particular ratio of CBD to THC, and on a day where it's dry and sunny without a front coming in, they may only require 2 or 3 drops. So this allows the patient to be able to microdose based on their own symptoms throughout the day, and have a lot more control of their own care. And when you do that, you allow the patient to be a lot more hopeful and in control of their own health. And patients absolutely love that.
Is that a call for us? All right, I think we do have a call, so we'll go ahead and take the call. Caller? Do you have a question, caller? Are they still there? Call. Hello, how are you? Hi, do you have a question? Thanks for calling. Is somebody there?
Hello?
Hello, can you hear me? Hello, can you hear me?
Yes, I can hear you.
How are you?
Not bad.
Is there a question?
No, I can't get online.
Oh, okay, so we'll go ahead and take the next call. I don't know if we can give assistance getting online at this point. So let's go on. Dr. Weng, why don't you go ahead and comment on what's the usual process for a patient who wants to get on medical marijuana or cannabis? What is that process?
It's a fairly straightforward process. The first step is to log on to the MMCC website. I believe that site is mmcc.maryland.gov, and register to get an ID number. That can be about a 4 to 6 week process, and they are simply just validating that you're a resident of the state and 1 or 2 other things. After or during that process, you can call a participating provider, physician who's participating in your area to go in for an evaluation for medical marijuana. During that evaluation, oftentimes the patient will have medical records documenting, corroborating some of their conditions, whether it's chronic pain or another condition. After they see the patient, the doctor will typically provide them a certification document, and once they receive that, the patient is able to go into the dispensary of their choosing.
Okay. Now, I know there's a price for that. You want to give a range of what that price might normally be that you're hearing about?
Well, there's recently the state is asking for all patients to purchase a medical marijuana card, and that's $50. That's going to be required by April 1st. But prior to receiving that card, you have to once again go through that process of registering and then getting certified by a physician. That price can vary, and I've seen it as high as $250 and as low as $125, and maybe even lower in some other areas. So depending on what the patient is looking for, if they're looking simply for just a certification, you may be able to find that at lower rates. If the patient is looking for a little bit more consultation regarding what their health issues are and their medications, then the cost may be a little bit closer to the $200 mark.
Okay, okay. And is there anything unique about the evaluation that doctor is doing? Can it be any doctor doing this? Can it be done online, or is it more of a face-to-face evaluation, would you say?
Well, Maryland requires physicians to see the patient face-to-face, and to also maintain a chart on the patient. and have a bona fide relationship with that patient, essentially meaning that they keep a chart on the patient, that they're following the patient, and doing all the things that they would do if they were seeing that patient for any other medical condition.
Okay. Do you want to share anything about a good outcome you had as far as the patient goes?
Well,
I'm sure you have so many good outcomes to share, right?
it's absolutely unbelievable. Where would I start? So my first patient was a 17-year-old young man who was diagnosed with Crohn's disease in 10th grade.
Wow.
And Crohn's disease is an inflammatory bowel condition, and symptoms can be severe diarrhea, cramping, abdominal cramps, bloating, distension, nausea, vomiting, etc. And this young man developed this condition at 10th grade, was having over 13 bowel movements a day, was not able to participate in sports and other activities in school, ended up breaking up with his girlfriend because he was embarrassed. He did not go to his prom. He had been on multiple medications for his Crohn's disease. We started him on a regimen of CBD and THC. It was a 1-to-1 regimen. And the young man came back with his two parents.
Wow.
He went from 13 bowel movements a day to 2 bowel movements a day. That was actually my first Crohn's patient and my first patient. I used to do, I don't want to call them studies, but I'd have patients come in on Fridays at my office from 2 to 4 with pain, any kind of pain. I'd have them rate their pain from a 0 to 10. I'd have them rate their anxiety from a 0 to 10. And we would give them CBD capsules. And in 30 minutes, 60 minutes, and 90 minutes, we'd ask them what their pain levels was. During that time, we saw some amazing, amazing things right before our eyes.
Wow.
We saw patients with 8 out of 10 sciatica pain drop down to 2. We saw patients with all kinds of back pain and osteoarthritis. We saw a Parkinson's patient with a severe tremor. All these conditions, and right before our eyes, we saw just an amazing change. And what was particularly pronounced about these stories was that I would say that all the patients not only developed less pain and less anxiety, but they also felt an amazing wow feeling. Like they could not believe how, after years of having so much pain, that it simply just lifted away from their bodies without any side effects such as nausea or fatigue or vomiting or abdominal pains. And they was just the first batch of patients that I started seeing, and from that experience I knew that this was something that I needed to learn more about. So I've seen patients with severe migraines, cervical stenosis, spinal stenosis, all kinds of diabetic neuropathies, and these patients have just really done well. I don't want to make it seem like it cures everything, because it doesn't, but it certainly can make a huge difference in patients' lives.
And I agree, I'll tell you. But the amount of patients we've seen, mainly for chronic back pain, spinal stenosis, like you're saying, where nothing else was helping or they were required to take high amounts of morphine and Percocets, this has really gotten them back to a real quality of life. It's been very impressive, especially when you talk to that person who's used to having an 8 to level 10 type of pain, and they truly walk in after being on this and saying it's down to a 0, and you just look at them like, wow. And it's not just for a day or a week, we're talking months. So tell me, what are you finding? Do they need to take it multiple times a day or once a day in many cases, or every week or so? What are you saying with this in general?
Sure. Well, certainly It depends on the patient, their physiology, their condition, and there's a lot of variability in terms of how patients respond even to given doses of the same, what seemingly be the same medication or the same treatment.
Mm-hmm.
If you take medicine or cannabis orally, you will have a longer acting effect, between 6 to 8 hours. If you take it sublingually, it may only last 4 to 6 hours. If you inhale it, it may last 2 to 3 hours.
Okay.
So if you're talking about, for example, a migraine, you want to treat that initially at the onset of the headache, and certainly one option would be to vape, because you're going to have a very rapid onset in terms of the effects of the medication. However, in addition to that, you're going to want to take something that's going to allow it to continue to be in your system, perhaps for the next day or two. So you would probably take a long-acting, that is an oral, maybe it's a pill or capsule or an edible, that will continue to last more than 2 to 3 hours. And by dosing it in a way that takes into account how long that condition would normally last, is it intermittent, is it continuous, does it just come at night? For example, you have patients who have nocturnal seizures primarily. In that instance, you don't really have to bombard the system with these cannabinoids during the day, but you can begin them toward the evening and allow it to get in their system and treat it with a long-acting product throughout the night. So you, just like in regular medicine, you tailor it to the condition and to the patient's symptoms.
Now, here at Doctors in the House, we pride ourselves on being an educational service and program. So I guess we do have to let people know insurances aren't covering this, right?
No, absolutely. Insurance does not cover this, unfortunately. There is a recent medication, Epidiolex, that was FDA approved for a very narrow condition for seizures, and that medication is approved, but not for just generalized epilepsy, but for particular types of seizures. And until we see more insurance companies getting in, patients will continue to have to pay for these medications. At the same time, I am happy to see that dispensaries are lowering their prices. The longer this has been out, we're seeing a decrease in prices for patients going in to buy their medicine.
Very good. So, you know, that might be a good time for us to go to break. And as we go to break, let me just say, as we get to the other side, we'll talk maybe a little bit more about the cost and some of the economics of what is turning out to be an incredible finding here in Maryland. You are listening to Doctors in the House, and we will see you in 1 second. right, welcome back. My name is Dr. Darryl Hill with Doctors in the House. I am a part of Laurel Medical Associates. My office number 301-497-0401. Also on the web, www.laurelmedicine.com. We are in the house with Dr. Weng talking all things medical marijuana. And we do have a video we're going to get into right now, and then we will get back into the show. Today is not video day. No videos today.
We don't need a video.
No video. So we are back in the house, and we were talking about some of the economics associated with medical marijuana, some of the costs. And I guess I can go ahead and just say the state of Maryland took in about $96 million in 2018 and are projecting as much as $500 million as we get into the year 2025. What do you think about that?
Amazing. They seem to be doing better than the dispensaries and the growers. I think that's a very large number.
Yeah, and it's funny because I think the rest of the country is seeing similar trends, and I guess this is what we expected, but didn't quite expect it to be this good. And hopefully that's going to translate into improvement clinically for patients as well.
Well, that would be nice if maybe they could reallocate 15 to 20% of those millions to a subsidy program for patients, perhaps who are seniors, who are disability and fixed incomes, to be able to go into the dispensary and be able to get their medication, because that is a concern.
I agree. And I guess since we're talking about it, the question is, where are we going to be in 5 years and 10 years with this compared to now? I'm sure the state was just trying to get things started, and as we get more established, we're going to see a lot of changes taking place. But where do you see this industry in 5 and then 10 years from now?
Well, I think there are about 29 states that are currently have medical marijuana, and there are a few that are supposed to legalize it in the next 6 to 12 months. And it looks like every 6 months or so there are 2 or 3 more states that are passing legislation. So it appears to be, by all accounts, a growing business, a growing opportunity, a growing way of treating healthcare issues, and a growing way of life. So it appears that this is just in its early stages now that more than half the country are participating.
Yeah, especially when we look into the issue of recreational. Now, we're not talking about recreational, but even states are moving forward with that as well. And maybe you too, but I know for me, a lot of my patients were already self-medicating with marijuana, and we're not here to advocate any illegal activity, but many people already knew about some of these benefits.
I think that's right, and I think that once again, my take on that is, whenever we, as doctors, talk about patients self-medicating, we often use it in a fashion that has a negative connotation, and that's because it can have adverse effects, whether you're self-medicating with alcohol and in fact you have bipolar disorder, or you have depression, or you self-medicate with another substance. It's an attempt to deal with your conditions and to get better. And so to that end, I think that physicians must learn more about this plant and how it works in the human body, and we need to listen to our patients, and when they ask us about taking medical marijuana, not to be so quick to judge, particularly because these are the patients who are on the sidelines and who are actually suffering and not being able to participate in work and family and all the social activities that bring us joy. So I believe that this is something that is here to stay, and because patients are going to self-medicate, we really need to know how to help them do that. Humans have been self-medicating since the beginning of time, and it simply just means that they've gone to alternative ways to find things that will help them get through a backache, get through stomach pain, get through preterm labor, get through a horrible migraine, get through a digestive illness condition. And once again, this is something that we've always had to do as people. And so for physicians, it's really, really a great idea to be able to help support your patients through this experience.
Yeah, I gotta agree with you, Dr. Weng, and I don't know if you notice it, but us as internists too, we see the full gamut of patients.
Yep.
And I don't know if you're feeling the natural movement taking place in society too. Nobody wants medicines anymore, and we typically are gonna recommend them when they're appropriate, but it is good to have something a little more natural.
Well, if you think about it, I was thinking about this the other day. Well, let me ask you. You've been in practice
30. I want to say 30, but 20.
20 years. 20. Yeah, I know. Yeah. 20.
We were in residency together,
yeah,
by the way.
Yeah.
He was a year ahead of me.
20 years, right? What's the difference in your recommendation, if any, if a patient calls you and says, I have a cold, what should I do? I could tell you, for me, there probably isn't much of a difference. In 2 decades as a practicing internist, it's essentially, what we've always said, 2 aspirin and call me in the morning, or whether it's 2 Tylenol, or take a Robitussin, or take some rest, or nothing to add.
Right.
Our tools are extremely limited. I was taking care of a patient who is 81 years old, and he has a healthy mind. He's on blood pressure medications. His kidneys are a little shaky, and I really couldn't figure out what to give my patient for pain, other than some roll-ons and some Tylenol. But anything else, an opioid, a muscle relaxant, anti-inflammatory medication, they all would be detrimental to the patient. So I think that this is a very, very good thing, because it just allowed us to expand our medical bag, if you will, the tools in our medical bag, and to be able to have greater options for patients. But one of the frustrating things as an internist is, we have patients with complicated conditions and so many different medications and multiple doctors involved in one's care, and then we're the ones who need to try and manage this whole thing and make sure all the medications are lined up and not interacting, and oftentimes it can be a very, very daunting experience. So I agree with you, and
I agree with you too that we are best positioned to be dispensing this, because we know the whole patient too.
Absolutely.
But tell me, what kind of worries, for that patient out there who's thinking about this, what kind of worries are you hearing from your patients that might be able to educate others about medical marijuana? What are you hearing from your patient? What worries them that you have to, help them get comfortable with?
I think many of the stereotypes are still there. I think for new patients, it's important to know that we're not talking about smoking. We're talking about things that you can put in your tea or your yogurt. Taking a couple of drops with some chamomile tea at bedtime for a very, very good night's sleep. We're talking about ointments that you can put on your knee or your hands or your wrist for rheumatoid arthritis, or a salve for your low back pain. We're talking about a pill that you can take that will last 6 hours, and you can take it in a way that's not going to cause you to have any constipation or diarrhea or nausea or anything like that. And if done carefully and slowly, the patient, once again, doesn't have to have any side effects, and oftentimes do not, and can reap a lot of the benefits. Some of the worries is exactly that. Will I be able to walk? Will I, what's going to happen if I'm high? And I remind them, I say, you've taken many medications with even more pungent side effects. I've given them to you. I've given you trazodone, I've given you Percocet, I've given you Lyrica, I've given you Motrin, I've given you Benadryl.
So it's your fault.
So it is my fault. And especially when you look at our prescription writing for opioids. I think in 2017 it was over 900,000 prescriptions, almost 1 million prescriptions were written by physicians for opioids. And it's interesting how we talk about there may not be any great long-term studies for medical marijuana for chronic pain. But when you look at the studies for opioids for chronic pain, it's a very, very low effective rate. Only a small slice of the patients do okay, but most of the patients do not do well with chronic long-term opioids. So I think that this is a conversation we must continue to have with our patients, continue to encourage them, to continue to show them that it's safe, it can be safe, and like anything, if done in moderation and done with the idea that if you overconsume, that just like any other substance, it can have some detrimental effects. I think of the high, Dr. Hill, as a side effect. Okay, so if I give you Benadryl for a rash and you also get sleepy, that was a side effect. Okay, and so what do? I will try and dose you at the lowest rate that's going to take care of the rash without you having the side effect. And so that's the same idea. So many times, and studies have shown this, that patients who can take a therapeutic dose of THC and that's lower than the dose required for the side effect. So that's lower than the dose required when they get high. And so this concept of or approach of microdosing, taking low doses of THC, is a very effective way to treat your patients, because you can oftentimes get to the therapeutic benefit, whether it's insomnia or anxiety or chronic pain, without having the side effects of feeling high. So I would say that the biggest concern is that patients do not want to be high, and that's a very good thing. And so with going slowly and adding CBD to the cocktail, it can often be attained.
Very good. If anyone wants to call in, the call-in number, 240-719-2560. So I think you're exactly right, Dr. Weng, and I cannot overstate just how much improvement and benefits I've seen. So it's important for patients to know about that, because this is really helping them get their quality of life back. I do want to add, and you can comment on this, well, I have recently heard, just to be transparent, there have been an increased number of traffic accidents that we're starting to see that are being linked to this. Have you heard anything about that?
I have not heard that. And I think that's certainly one thing where doctors need to continue to encourage patients not to use substances that's going to affect their ability to drive. That includes THC, alcohol, some pain medications, etc., even Benadryl. And what we have seen and what we do know is the decrease in deaths and traffic accidents related to alcohol in states where medical marijuana is legal. And at the same time acknowledging the limitations of all of these substances, including the limitations of THC. And THC certainly can affect coordination and hand-eye reflexes and the ability to respond quickly when an urgent matter occurs. These areas in the brain that are responsible for that are affected by THC. And so there has to be education, ongoing education to patients. So this is something that needs to be looked at and paid attention to, and patients and physicians need to be educated on this. That marijuana, THC, is not a completely benign substance, that you can have side effects, that you can have complications, that you actually can have some addiction to it, and that everything needs to be taken in moderation, and you need to use it smartly and wisely. And that means you don't want to get behind the wheel, you don't want to operate heavy machinery if you're impaired or intoxicated, and you once again want to respect the side effect or the possibility of the side effect of causing cognitive impairment.
Well, that's important, but if you're dealing with a product that only has the CBD in it, there shouldn't be as much a concern, I'm sure, right?
Actually, there really isn't a concern. Once again, that the THC is at a very minimum. And my motto has always been CBD during the day and CBD/THC in the evening for patients who have to be on the road or have to work. And that usually is a very, very nice combination, because even if the CBD doesn't take away all their pain, it definitely takes the edge off, and it definitely helps with muscle tightness and tension and anxiety. Anxiety makes everything worse, including pain, including spasms, and so often the patient has a much, much better day with just simply CBD alone. And then when they're in the confines of their own home, they can take a combination of CBD and THC, or simply just THC, depending on what the situation is.
Very nice. So again, if you want to call in, 240-719-2560. We are getting towards the end of the show, and I do want to make it clear, we are seeing very high-functioning people coming into the office. You know, what comes to mind for me is the nurse, the doctor, and even the college professor who's able to now use these substances and really be able to maintain their professional lives and be productive and have their quality of life. So that's important.
I think that's a very good point. I would say that the majority, if not at least 90%, I would say, of my patients who I've seen are all working folks. Many of them have fields in teaching and nursing and law and accounting, and everyone, no one's immune from chronic pain, from depression, from PTSD, from insomnia. And so to be able to legally purchase this, to be able to go into a dispensary, to look and learn and look at all the different options, and to not have to take something where you don't know where it's coming from, you don't know what it's laced with, and it's legal, and you have a family, you have a degree, you have a profession, you have a job, and you don't want to lose that, and it's important. But you should still be able to get the treatment that you need. And so this is a wonderful, wonderful opportunity, and we see this all the time. More and more patients are coming in from various segments of society and various socioeconomic classes, and we see just how uniformly this is.
Now, I do want to talk about two rather controversial points of this topic that maybe you can help shed some light on. The first one is the federal government's approach. And I know we don't want to get too much into politics, so we'll see if we can navigate this without getting into trouble.
Sure. Let's try it.
So what's your thought on that? Because I know the states are making it legal. The federal government really hasn't changed their position to a degree.
Yeah. Well, one good thing is the Farm Bill was passed this past December, which allowed folks inside the United States to grow hemp and sell hemp products, specifically CBD. Prior to that, all cannabis products, including anything from hemp, was considered Schedule 1. Well, Schedule 1 means that there is no medical benefit and can only be harmful. So substances such as LSD and heroin is Scheduled 1. Well, those of us who know a little bit about this realize that that simply made no sense, and there are other reasons that probably have little to do with health or medicine as to why cannabis is considered a Scheduled 1 drug. You know, if you look at the history of cannabis, you see that it's been around in the world for thousands and thousands of years, starting in ancient China. In India, we see treatment for all kinds of conditions in Greece and Egypt, and it first came to Europe in the early 1800s, and when it got to Europe, it was brought in by an amazing scientist and physician, Dr. William O'Shaughnessy, who was the first to show us how this can be taken as a tea form and how it can be taken for all kinds of conditions, the same conditions we see here today, such as spasms and chronic pain and seizures, etc. And so the marijuana had fallen out of favor as pharmaceuticals such as Bayer in the 1890s had wanted to replace it with aspirin, and since then it's really just gotten more and more out of favor. But prior to the 1930s, physicians here in this country was using cannabis to help with depression and anxiety and headaches and pain and insomnia. And so we use this, and when cannabis was taken away, if you will, or made illegal in the 30s, doctors and the AMA had no voice in that decision. We see sort of the same things happening in our Congress today as it relates to health care, that we have no voice or input. So I think that's a mistake, and I think it was always a mistake to remove it, and it had nothing to do with the detriments or any concerns about about cannabis or marijuana, but simply about other things.
Wow. So I know we're wrapping up. Anything else you want to add that maybe we didn't touch on?
Well, if those of you who are listening and would like to know more, my name is Dr. Charles Weng, W-E-N-G. My number in Towson is 410-339-3850, 410-339-3850. And you can also find me on my website at drweng, drweng.com. I am an internist. I treat all sorts of conditions, and my attempt is to try and use a comprehensive approach using both Eastern and Western medicine to bring about the best quality of life for my patients.
Very nice. And I know on April 13th, we will be hosting, along with a certified educator, more information about medical marijuana, and you will also have a chance to get certified and registered, if you like. And this will take place at the world-famous Woodmore Country Club from 9 to 12, but feel free to call 301-497-0401 if needed for more information. So I know we got a few more minutes, and we're wrapping up, but maybe we can just talk about where you might see things in another 50 years or so with all this.
Well, I tell you what I've seen in the last 2 years, 3 years, that patients' medicine cabinet is looking less and less filled. It's absolutely true. You asked me about a patient earlier who, or patients that come to mind, and I saw a gentleman a year ago. I'll tell you about two guys very quickly. I saw one guy about a year and a half ago for the first time. He had been taking no less than 12 to 20 200 milligram ibuprofen pills a day. 12 to 20 200 milligram ibuprofen pills a day for his chronic arthritic pain. When I saw him in follow-up, he asked me, how many pills do you think I've taken? And I said, I don't know, 3 a day, 4 a day? And he said, if I've taken more than 12 ibuprofen tablets in the last 12 months, that's a lot.
Wow.
So he went from 12 to 20 a day to over 12 in a year.
Wow.
That was just with the combination of CBD and THC. The second patient that comes to mind was someone who used to be a bodybuilder. He's 70 years old. And he came to me. He had severe neck arthritis in his neck and his back, but particularly in his shoulders. And at the time, he could only do one push-up, barely one push-up, because of the severe pain in both shoulders. When I saw him about 3 months ago, this is not an exaggeration, 70 push-ups.
Wow, that's more than you.
It is more than me. And he's 70 years old.
Impressive.
And this was simply with the wonderful anti-inflammatory effects that the CBD and the THC has, and him getting off of the other medications. So these aren't extreme, by the way. These aren't extenuating circumstances. This is what we see on a regular basis. I tell my friends and colleagues that in the last 3 to 3.5 years, it's been incredible. Witnessing how patients' lives have turned around. And lastly, I would say that the patients who do the best, they take their plant-based treatment and they also extend it to their diet. Mm-hmm. And when they do that, then they really begin to see the true benefits of their entire makeup, that they're off of meats, or they decrease their meats, they decrease their refined starches, that they're decreasing the bread and the white rice and the sweets, and they're drinking more water, and they're exercising now because they have less pain, and they're sleeping better because they have less insomnia. These patients are really getting back into life. Their relationships are coming back. Many of them are wanting to get back into the workforce. I had a patient who was on disability, and when she came, and after months and months of using medical marijuana, she had gone off of her opioids and her benzos, and she was a new person.
Wow.
She was ready to get back into the workforce. And it's just a beautiful thing to see, Dr. Hill.
So she got her life back. And, so I want to thank you, Dr. Weng, for coming in.
Pleasure, good to see you.
I want to thank you for being one of the first to get into medical marijuana like myself. And we look forward to seeing you at our next episode of Doctors in the House. Thank you.
Thank you.